As the world commemorates this year's Mental Health Day, the First Lady of Nigeria, Oluremi Tinubu, is calling for more commitment to improving mental health awareness and enjoin individuals to seek medical help and early counseling. The First Lady, in a statement, calls on individuals to speak up, explaining that emotions bottled up is the beginning of mental health issues and challenges that confront individuals. According to Senator Tinubu, if there were no fears of stigmatization, people would tend to speak openly about their struggles, thus leading to early diagnosis, thereby improving recovery outcomes. This year's theme, "It's time to prioritize mental health in the workplace," is timely, especially in times like these when most people feel dissatisfied at the workplace for several reasons that could affect one's mental well-being. Joining me now for more insight on World Mental Health Day is an occupational therapist, Victoria Amu. Ms. Amu, thank you for joining us on the news this hour. Let's begin with some interesting statistics here. They say 1 in 5 Nigerians experience mental illness. That's according to the Nigerian National Mental Health Survey of 2017. And WHO is saying that Nigeria has a mental health treatment gap of 90%. How did we get here?
We got it. Good afternoon, first of all. Thank you for having me. It's always a pleasure being on TVC. How did we get here? We got here because a lot of people do not know what the composition of mental illness. And a lot of persons think, oh, it's my brother's child that has a mental illness. It's not me. It's not my child. So nobody is concerned about what mental illness is about. We also got here because government has not placed a lot of emphasis on mental health. And Nigeria as a whole, Nigerians don't determine that somebody is mentally ill until they start to strip themselves naked. And that's one of the causes of we getting to where we get to as a country. There's no money in health ascribed to mental illness. You just have the psychiatric hospitals doing their best. And then you have something called the revolving door, where the patient goes into the mental health hospital, is treated and taking his medication. And then when he cannot afford or she cannot afford to take her medication, she decompensates. And when she does decompensate or he decompensates, he now has to be rehospitalized. And then it's a revolving door, it keeps going. So government has the problem of not putting enough money, not making sure mental health care is adequate for the country, not helping people in the community to know when they have mental illness, and being able to know that your family member has mental illness are easy things. But people do not know the signs, they do not know the symptoms. So they are not able to bring their family member to the hospital at the acute stage, because in every disorder, the acute stage of diagnosing is the most favorable stage. That is where the person is actually given the person gets more ability to live longer and enjoy life, even with their disability. So that's how we got here.
You know, I almost forgot that you're an occupational therapist, given the conversations we've had in the last months and last years. But how do you see occupational therapy bridge this gap, especially in Nigeria?
We're doing a lot as occupational therapists. First of all, we are doing something called information dissemination. We want to be able to enlighten people what is the meaning of what is mental health. Mental health is when somebody has schizophrenia, mood disorder, or anxiety disorder. It's not just when somebody is sick or when somebody can't go to the hospital or when somebody can't go to work or when somebody doesn't play. It has a lot of components in it. When somebody is schizophrenia, we want to be able for you to be able to identify your family member if they have any mental illness. You know, we want to tell you that when there is schizophrenia present, that means there's thought disorder. That means the person hallucinates. How do you hallucinate? You hallucinate by saying, oh, I'm looking at that wall. and the wall is talking to me. I know we all have family members who say that, oh, that wall told me somebody is going to come and kill me, you know, and the person is fearful, which is mostly auditory. They hear things. Some see things, some hear things. Then you have delusional. That is where it's bizarre. Then you have disorganized speech. That's when they are talking to you, they are incoherent. Their speech is pressured. They are speaking, they are gibberish in what they are saying. So you must know the signs. Then we have mood disorders. Mood disorders are major depressive episodes when the person is daily distracted. The person has the distraction, the depression affects their daily task. They cannot walk. They cannot do things that they should normally do. Then you have, in mood disorders, you have manic episodes, which will have abnormal, elevated moods, where they are overly happy. You know, in some manic episodes, you find them putting on makeup, and the makeup is totally skewed. You know, they'll be putting yellow on top of green, and then they'll tell you, no, I look beautiful, you know. Then you find the men putting on a lot of color riot suits, and they tell you that they are okay. In those major depressive episodes, you have poor appetite, you know. This is for you to be able to help your family member recognize when they are at acute stage of mental illness. They have insomnia, they have difficulty sleeping, they have low self-esteem. One should not sleep all day, one should not sleep all night and sleep all day. There's something wrong. Then there's insomnia, lack of sleeping, there's low self-esteem, you know, and most of the time poor concentration. And then you find these people say, you know, I just feel like dying, you know, because they have low self-esteem, nothing is working for me, I don't have money to go to work, I don't have money to eat, it's hard for me. And it's okay for somebody not to have money to eat, it's okay for somebody not to have money for work, but when you even go to the work and you are tired, you are fatigued, that's this thing. So that's where occupational therapy comes in.
Indeed.
And what do we... Yes.
I hear you clearly, but we have completely run out of time. You know what they say that, okay. I'm sure you've heard the expression that everyone has a 5 minutes of madness, and the duration is higher now in Nigeria with the burnout, the stress. You know, fuel is now selling at over 1,000 naira. This year's commemoration has a lot to do with work-related stress. And we're going to continue this conversation as to how your field, occupational therapy, can support workplace mental well-being. But that's how much time we have now. Victoria Amo is occupational therapist. She joins us live on the show. Thank you so much for talking to us.
Thank you so much for having me. Take care of your health.
Absolutely. I'll do my bit, Ms. Amo. Thank you.